that it can really limit the amount of sleep that you get, and the ability of getting to sleep. It can be extremely annoying, and when it gets very bad, it can even extend to giving you difficulty when you're in a plane or in the movie theater. And basically, what it is abnormal feelings in the legs. It can be a jumpiness. It can be crawling feeling and then jumping. Matter of fact, if you were to have 100 people describing their restless legs, you would have 100 different descriptions. It's one of those neurological disorders that have no specific description. Patients basically will tell you that whatever their description is, whatever they tell you that they're feeling, it is interfering with their ability to fall asleep, to relax, and to enjoy what they're doing at the time. And what they're doing at the time is basically relaxing. They're either in a chair or they're in bed trying to get to sleep or watching TV. It usually occurs at night. But the amazing fact about it is that as soon as you get up out of the chair or out of the bed and onto your feet, the symptoms go away. And that's one of the pathognomonic symptoms, is that it goes away as soon as you get up. So what patients usually do when they don't realize that they have that disorder is that they keep rubbing their feet, or they stretch their feet, or they rub their feet, or some take baths. Some have even there are people who have discovered that doing video games helps. There's all sorts of ways that people have devised to help. However, none of that is necessary anymore because there happens to be excellent medications, a godsend to me, I can tell you, because it works so well. And it's basically the medications that are used for Parkinson's disease.
Is it dopamine? Is it like...
Yes, it's the dopamine agonists, they're called. It's either Requip or Mirapex. Now, there are other medicines that can be used. There's, for instance, Klonopin, but I don't like using that because the Mirapex and Requip are so good that you'd hate to give something that's that sedating and that potentially, I won't say addictive, but people become dependent upon it, and they really can't get off it very easily like you can with Requip or Mirapex. So we use Requip and Mirapex. They used to use Cinemet, but it's not necessary, as I say, because you have these great medications. And I can assure you that it will help. It's not like other neurological disorders that you say you hope it helps. These medications actually do the job. And like I said, it was God sent to me because it, without a doubt, it took away the restless leg. Now, there is a certain way of taking it, and you have to learn how to do it, and eventually you have to work out the right dosages. But I can assure you that if you're plagued with restless leg syndrome, there is definitely a cure out there for it. It's not a cure. I mean, there's a way of helping it.
That's great. It's wonderful to hear you talk about this. It's, as I said, it's so little known, and I'm so glad you wrote an article on that. I'm sure there are other kinds of things that hopefully you'll be writing articles on that make people aware that they don't even know they have something, and that's always the fallacy. But as a neurologist, I know when people fall or they're having headaches, they always say, go to a neurologist and see what's going on. And so what are your tests?
Our tests...
what do you do if someone comes and said, well, I fell and I don't seem to be remembering things, or I have headaches? Do you do MRIs first? Or?
Yes. I wouldn't say first because MRIs are very, very good tools, and we use it a lot. But it's not something that should be ordered without good thought into the process, because, and that's the reason why the insurance companies will very often not allow the primary care physicians or the internists order the MRIs for neurological conditions, because they know that we have a little extra expertise and ability to know when the MRI has a chance of showing something or whether it's not needed. But if we order the MRI, then they know that it's definitely needed in order to make sure that there's nothing more serious going on.
So are you dealing with people, let's say, with migraine headaches? Are you the kind of a physician?
Matter of fact, I see a lot of migraine, and it is one of my interests. My main interest is headaches. And matter of fact, I'm hoping in the near future to write an article about headaches for older people. You know, migraine is considered something that's for younger people, but every once in a while I'll see an elderly person who either has continued to have the migraines at their age or have actually even started to have migraine, which is very rare, but it can happen. But headache is a special interest of mine, and that too can be helped. It's one of those neurological disorders that when I was in residency there was hardly anything to do about it, but now there's plenty of medications, and headaches that are relatively benign headaches. I'm not talking about headaches for tumors and things like that, but migraine and tension headaches and other benign headaches can very well be helped.
I am so glad. So we can expect to have an article from you, hopefully, on that. We have probably a few minutes. I just want to go back now to our expedition study about Alzheimer's. So if you are to be eligible, let's start with that. For the expedition study, the participants must be 55 years or older, generally healthy, and that's something I guess Dr. Cutler can explain, have mild to moderate Alzheimer's disease, and have a reliable caregiver who can assist him or her during the study. You understand that because usually they would be having someone anyway, hopefully.
Yes.
And participants can continue taking their current Alzheimer's medication, and the investigational medicine, study-related evaluations, and laboratory tests will be provided to qualified participants at no cost. I want to repeat that. The investigational medication, study-related evaluations, and laboratory tests will be provided to qualified participants at no cost. I mean, this is a wonderful thing. There's no negative parts to this that I can see. You're going to get all that. You're going to find out more. You're going to be a part. You might be helped, and you might be a part of a major breakthrough in something, because Dr. Cutler would not be wasting his time on this if he didn't feel this was worthy of the study. So we're feeling very happy about this. And if you want to call 954-475-8171, that's 954-475-8171, and don't be afraid to make the call. The organization is called, his organization is Neurology Clinical Research, Inc., Neurology Clinical Research, Inc., and remember, if someone answers the phone, they're going to be asking you a few questions to make sure that on the surface you seem like you are a candidate. And then after that, I'm sure they'll set up an appointment, and then you'll go and see Dr. Cutler. And I'm sure that's going to be a wonderful experience. So, Dr. Cutler, I can't thank you enough for taking your time, and look forward to many more of these.
Well, I thank you very much, and this was a pleasure, and you can be sure that anytime that you need me to speak on a topic in neurology, I'll be more than happy to.
Fantastic. I'm sure people ask me about speakers, and I will certainly give them your name.
Thank you.
Thank you, Dr. Cutler. Have a good day.
Thank you very
Bye.
much.